You are made to move. Research suggests that the more sedentary we are, the more damaging it may be to our health. Sedentary comes from the Latin word sedere, which means to sit. In recent years, we have enjoyed the conveniences of using a TV remote control, being entertained by video games, reading and working on a computer, and texting for a dinner delivery. All of this has resulted in more time sitting. The combination of lack of physical activity and too much sitting has contributed to the major epidemic of obesity. How does this really affect my health? When we move, our muscles contract, which allows fat deposits to go from the bloodstream into the body. If we don't move, the end result is that fat deposits stay inside the bloodstream, causing an increased LDL cholesterol, which leads to plaque buildup. In addition, the healthy HDL cholesterol that typically comes along and rids the body of LDL cholesterol is impaired with lack of moving. Sitting for long periods of time also leads to elevated blood sugar levels. The end result is the more sedentary we are, the more likely we are to have a higher waist measurement, lower HDL cholesterol, higher triglycerides, and less effective insulin. These are known as risk factors for heart disease. Specifically, people who sit more than 7.5 hours a day are in this category. There is another element to consider, and that is those people that may sit a lot, but also take a lot of breaks, can significantly lower their waist measurement, and improve their fasting blood sugar, HDL levels, and C-reactive protein, which is an inflammatory marker used to estimate coronary artery disease risk. Breaks can include walking to the mailbox, taking multiple trips to certain areas in the house, or walking several times a day to the water fountain. Taking multiple breaks, even if they are for a couple of minutes, has been shown to help with risk factors of heart disease. How many breaks should I take? Anything over 67 breaks per day leads to healthier outcomes. The more breaks you take, the better results you will see. The key is to add movement into your everyday lifestyle. To achieve the 67 breaks per day, take 5 breaks for each hour of the day. Recommended breaks at work are walking to a coworker's desk instead of emailing or calling them. Take the stairs whenever possible. Set a timer for every 20 minutes and walk in the office. Take the longer route to the restroom, or have walking meetings with your coworkers. To help with taking breaks at home, wear a pedometer. When watching TV, stand up and move with every commercial. At the kids' or grandkids' athletic functions, pace the sidelines. Walk up and down each grocery aisle, but don't always buy. Walk around the department store before actually shopping. After reading 15 minutes of a book, get up and take a walk. Walk while talking on the cell phone. Now is time to get moving. We have about 640 muscles and 204 bones in our bodies that have to move. The recommendation is 20 to 60 minutes of aerobic exercise. You also need to be active outside of the aerobic exercise. Being active and not living on the couch is vital to long-lasting health.